Good morning. It is Tuesday, August 24th. Welcome into the Morning Medical Update. Today, we are talking about COVID-19 testing. Testing is up along with positive cases. Lab workers are exhausted. Do the tests work with the Delta variant? We hear from Dr. Rachael Liesman, Director of Microbiology in Pathology. We're going to be talking about testing, and we're going to take an at-home test right here live on the set. So stay tuned for that. But first, let's get to our COVID count with Dr. Dana Hawkinson. How are you? Good morning to you.
You know, everybody's exhausted.
Right.
Really.
I think you are correct.
From testing, from symptoms, from working.
Telling people to get their vaccine.
And it's unfortunate we still have to see people who are getting sick and their families are getting sick, and then they say, I wish I would have gotten the vaccine. This has been going on for a year and a half or so. Really, everybody should be open to what is going on and how real this is. So please, I would still encourage everybody to get their vaccine so you don't end up in the hospital. We know how protective the vaccine is. Unfortunately, we do have a lot of patients in the hospital, and the majority of them, as we saw from our last numbers from Friday and Monday, that the majority of them are unvaccinated. Right now in the hospital, we have 66 active patients, with 26 in the ICU and 14 on the ventilator. We still have 33 in that recovery period as well. Hayes has 16 total patients with 11 active and 5 in that recovery period as well. And then also Children's Mercy is really holding steady with 15 positive and inpatients at this point in time.
Thank you for the numbers today. Yeah. We'll get back with you here in just a minute. We got some reporter questions on the line.
We do. Good morning. Cody Holyoke with KMBC 9 News.
Good morning, Cody.
Hey, good morning. Doc Hawk, I know you talked to Donna yesterday after the Pfizer news broke, but this is really the first briefing that you guys can talk about this. I'm curious, just your take on this monumental move with the full FDA approval, and have you seen anybody in the last 24 hours, or have you heard of anybody getting the shot because of the approval? I had a close relative who did that yesterday. I was just surprised by that. I'm curious if you're seeing that.
You know, I don't know specifically. We'll certainly talk with the head of the vaccine operations, Kim Dixon and Adam Meyer, to see if they have seen that. Hopefully we will see an uptick, though, because of the new approval. And again, hopefully that pushes some of those more vaccine hesitant people kind of over the line to go ahead and get vaccinated.
And my next question was about schools. We've seen a couple of schools in Johnson County especially where they've been back in class for a week. Even with masks, see a surge in infections, I think it's safe to say. What are your thoughts on that, on what people can do? And does this, and it kind of forays into Dr. Liesman a little bit, but does this boost demand on testing and strain that demand?
You know, I think so, but we do know from the pre-vaccine period, from when, you know, younger people or adolescents weren't able to get the vaccine because it wasn't authorized or approved yet, we have seen that we know how to keep kids and those adults in those schools safe during those school hours. And so I think having the masking is important, continuing to distance as much as possible. You know, it's still, although it's really hot, it's not, you know, if you can do things outside and get outside, you can take off the mask. But we know how to keep the kids safe in school and those families. And we know and understand that when there is spread around those kind of school areas, that it's probably more related to extracurricular activities or gatherings outside of schools. I think the important thing to remember is that if you do have the masking in the schools and the distancing or the de-densifying as much as possible, if there is a household that has it, maybe one child has it, they may be less likely to spread it to others in that school. So when the contact tracing is done, there won't be a majority of those kids out of that class and then quarantine for 14 days. Overall, hopefully it will continue to keep people in schools, especially those children, and keep those adults safe as well. But we will see when those schools that don't have masking mandates or have masking rules in place, we will see what happens with those. Obviously, we've already heard and seen what happens when, say, Florida, for instance, went back to school, and how many kids were out and how many quarantine days and classes were out because of that. So I think it is still relatively early in the school year, but hopefully if everybody does the right thing, we can keep those kids in schools and don't have to have whole classes be out for quarantine.
Other questions today? Yeah.
Yep. One last question. My producer wants me to sneak it in here. This ivermectin nonsense that's going on with this livestock dewormer that people are apparently taking. It's ridiculous, and I know the FDA and health experts have said, don't do this because this is meant for a horse, not a human, and it's for dewormer, not a virus. But what are you seeing anything like that there? Are there any? Is it an issue here at all? I'm just curious.
Yeah, apparently our poison control hotline is getting about 1 to 3 calls per month about using ivermectin. Again, ivermectin is a very good drug when it's used for the reason that it is approved. Humans can take it, but if they take it in the wrong doses, there is certainly that risk of adverse events and side effects. People don't want to get a vaccine because they're being, they may get a headache or feel bad for a day or two. But, if you take ivermectin in the wrong way or you take too much, you can certainly get toxicity from it, including central nervous system toxicity and things like that. So there are much more and worse side effects with ivermectin. And it's amazing to me people still would like to do this. Again, just as you mentioned, we do have to say that the NIH doesn't recommend for or against the use, but the Infectious Disease Society of America, which is a bunch of IDE infectious disease physicians, recommends against the use. World Health Organization recommends against the use of ivermectin, and the FDA also, I think, has a warning not to use it. So if you are using it, if you know people who are prescribing it, some of your physicians or providers, again, I think it's time to get other providers and physicians because they are not keeping up with the most consistent data at this point in time.
So, Dr. Hawkinson, why would humans use it? You said if you're using it in the right way, what would the right way be for?
Well, still for parasitic infections, just like with animals. But again, those are going to be prescribed in very specific circumstances.
Other questions today?
Hi, I have a question this morning. Hey, it's Taylor at 41. Good morning.
Hey.
Taylor.
I want to ask about the at-home testing kits you can buy. Obviously, with testing being up, I know you guys are talking about that this morning. Just one about how well you can trust the accuracy of something like that if you buy it at a pharmacy or something like that, and if there's any sort of recommendations on best practices, like if I've got a little sniffle that might be a summer cold, should I go ahead and take one of those, or should I save it until I know, that kind of thing? Is it a more of a break in case of emergency kind of thing, or is it if you feel any kind of bad at all, go ahead and take that, and how much can we trust them?
Perfect question for Dr. Liesman today.
Yeah, definitely something that we can talk about in pretty good detail. The initial data on that suggested they were reasonably sensitive. I think a lot of the real world data has backed those numbers off. And so it depends on the patient population we're testing, but the sensitivity on these tests tends to be reported at sometimes as low as 50 or 40%, sometimes as high as 85%. So I think that if you are not symptomatic, it's probably not a great choice. I certainly wouldn't rely on it as kind of a rule-out test to take before doing an activity. That would make me a little bit nervous. If you're symptomatic, it'll give you a really quick result, and that can be helpful, but I think that given the low sensitivity and just the potential ramifications of missing a case, I would recommend that if you get a negative, you go and you get a PCR test, because those have much better sensitivity. I think the availability of those PCR tests is quite good nowadays, and the turnaround time on that is really pretty good as well. I think most places are giving results on those in 1 to 2 days, and so there isn't this long extended wait. Most people can get you in either at your provider or at some of our retail pharmacies, get you tested pretty quickly. And so I think because we don't have those long waits, that makes PCR-based tests a really good option still. So I think the home test, it's not a bad thing to have on hand. It gives you a really quick result, but if you're symptomatic and negative, I would recommend following that up with a PCR-based test.
And we're going to be taking one of those tests here in just a moment.
Yeah, we can show you how it's done.
Yeah.
But and just a quick follow-up, if you're symptomatic and positive, should you be able to trust that that's an accurate positive and you actually do have COVID if you get that at home?
Yes, if you have symptoms that are consistent and you have a positive test, I would consider that a positive. I would quarantine at home. I would, make sure you've informed your healthcare provider and follow those recommendations.
Great, thank you.
Thanks, Taylor. All right, so start getting your community questions in. We're going to get to those here in just a few moments, but I do want to turn back to our guest, Dr. Rachael Liesman. She is the Director of Microbiology and Pathology here at the health system. Just want to ask you a few questions to get the conversation going today. So just tell us in general, what is going on in the labs right now? What is the load like? How is staff doing? What does it look like up there?
The labs are busy. When the hospital's full, the laboratory is very busy, not only in our COVID testing area, but across all of our laboratories. We have a lot of patients to take care of. The laboratories are integral to that patient care mission, and so the labs are busy. Tired, but continue to be motivated to provide the best patient care for our community. We have a lot of new faces in the laboratory, certainly have done a lot of hiring. A lot of labs in the metro area have done a lot of hiring, training new people and everything. And so we're happy to have all of these people. The labs definitely are a little bit stressed, but we continue to make sure we have surge capability, meet the demand for COVID testing, as well as make sure that we're taking care of our patients here.
So not only a spike, though, in COVID testing, but also RSV. How are they handling that?
Yeah, that's been a real surprise. So RSV, we think of oftentimes for little babies or neonatal patients, also a problem in elderly individuals and our severely immunocompromised populations. So something we worry about. Normally we don't see RSV until fall, early spring, so it usually picks up in about the fall, peaks somewhere around February normally, and then kind of trails off after that. So we see that sort of after influenza virus. Big surprise to have it in the middle of the summertime. Not something we're normally diagnosing in July and August, and we're seeing quite a bit of it. So we're seeing 10-20% positivity here. Not doing a ton of testing, but running 30, 40, 50 tests a week for that. I know our colleagues over at Children's are seeing a lot of that impact on their population. The other virus we're seeing is PIV3, parainfluenza virus 3. Again, something that we normally see in the fall and winter, normally think of as just causing an upper respiratory illness. Parents might know this one too, a big player in croup, so causative agent of croup.
So is it more in younger people?
And so we oftentimes worry about it in younger people, but a big risk in our immunocompromised population as well.
And what's it called again?
PIV3, parainfluenza virus 3.
So just not the regular old flu. Right?
So different, yeah.
Okay.
So related, kind of a cousin of our influenza viruses, yeah, but a different virus. And we're seeing a lot of that kind of now in the community as well. So it's really dangerous for immunocompromised people. So
when you see all this increase in testing, we like that people are getting tested. So that's good news. We don't like positive tests. But what does it tell you when you're busy like this and people are getting these tests done? What does it say about?
Yeah, I mean, I think that it gives a really good snapshot of what's circulating in our community. Obviously, it's important that we know that there is this RSV peak out of season and this PIV3 peak out of season. We continue to look for flu. I'm a little bit worried that we're going to have an out of season influenza virus. Not yet. A little blip here and there in some different states. None, as best I'm aware, in Kansas. None in our lab for sure yet. But we're on the lookout for that too. And so I think that testing is important in just getting an idea of when these viruses are emerging, when they're kind of entering into your community, so that we make sure that we're taking the best care of our patients and that we're protecting our patients, especially our immunocompromised patients here, and then obviously our pediatric patients as well.
A couple questions specifically about the tests, but can these COVID tests detect the Delta variant? And is that even important to know?
It can, yeah, it's really important to know. Anytime we have any of these variants of concern emerging, we always want to check and make sure that this isn't having any impact on the performance of our test. We do that a number of different ways. So the first of all is we just look on paper, right? So we know where the mutations are in these variants. We know what areas of the virus our tests detect, and we make sure that on paper it doesn't look like there's going to be any impact. So that's the first thing we do. We do that essentially with all of the emerging variants. Our vendors help us out. The people that make the test, that we buy the test from, they're going to help us out and kind of provide that data as well. The next thing we're going to do is we're going to make sure that we've actually tested those physical viruses. So when you get enough, when Delta emerged, that we had enough examples of that virus, we're going to use that virus to make sure that we don't have any issues with detection. And then finally, we rely a lot on our clinical partners to let us know if they think we're missing a case, right? So I occasionally get calls. I'm pretty sure my patient has COVID. They have all the signs and symptoms. We're not detecting it. Your test was negative. What's going on? And so we'll work through those cases. And one of the things that we're asking is, do they have a variant that maybe we can't detect? We have not had that incident yet, but that's another way that we kind of look for that. So something we are always on the lookout for, really important as new variants emerge. We're going to continue looking for that. Another aspect of our tests, usually most of our tests are detecting at least 2 targets, so 2 areas of the virus. And this gives you some redundancy. So even if you start missing one area, you're going to pick up that other area and still get a positive result and not have a false negative. And so there's a lot of backstops, a lot of safety nets on this. We were prepared. We know RNA viruses mutate. They act like this. This was expected. And so we were really well prepared to make sure that we are detecting all of these variants.
Okay, so let's talk about these at-home testing kits. You picked up a couple.
I did.
Where'd you go? You can grab them at Target, CVS?
So they didn't have them at Target.
Okay.
But I did get this one at CVS. They had the Binex Now. This is an Abbott test. And they also have an Ellume, ELLUME. So just 2 different vendors. Most of the data suggests that they perform equivalently.
Okay.
So not a big difference. The first thing I was surprised about, these tests are expensive. I brought my receipt. It's from CVS.
Okay, what you got? What's the damage?
So this cost me $26 for 2 tests. I was a little surprised by that. I think when we first started talking about these, they were hoping they would come in at a price point of $5 or maybe even cheaper. So I think that, I think it would be probably too expensive for most families to do something like weekly testing of their kid that was going to school or something like that.
Right.
So a little on the expensive side. And I bought the Abbott because it was cheaper than the Ellume. So the Ellume, I think, was priced out at like $38 or something. Yeah.
Per test?
Yeah, for 2.
For 2, okay.
Yeah. So this ends up being, $13 a test.
Wow,
yeah. So that's expensive.
Maybe it'll come down.
I was a little surprised.
Is more people buy them?
Maybe.
How long have these been out? How long have we been able to buy these?
Oh gosh, when did these get EUA? I mean, they've been out for several months. I think they've only recently been really available. So I think it's only really since this summer that you could easily find them if you went into a store. They've had EUA for some a little bit longer than that, but I think production and availability, to get them out and available to consumers.
All right, let's see how it works.
Okay, so the first thing is, if you're one of those people that never reads directions and you just like get a cabinet and put it together, don't do that with lab
And then there's like 3 extra screws left over.
Right.
Yes.
So my first piece of advice is read the directions.
Okay.
It's really important. Laboratorians read all of the directions, like usually 4 times. So make sure you read the directions.
I'm glad you're here because you can read it for me, because I would blow right through that.
We'll do that.
I would have already been in that box by now.
I know.
It's like IKEA.
The other thing is, don't do it IKEA style. The other thing, there's some really important information on the outside of the box. So you probably can't see it, but there's a little sticker here. That sticker is where you're going to find your expiration date. So this is also, treat this like the food in your fridge. When it's past its expiration date, throw it away.
Is that a QR code?
There is a QR code here. I don't know what that links to.
Okay.
The expiration date is by this little hourglass thing. Like that little game timer. So there's an expiration date on there. Don't use them past their expiration date.
Okay, so check it before you grab it, even off the shelf.
Check it. If it's been in your house for a while, give that a check and make sure it hasn't expired. Okay. There's another date on here. It's by this thing that looks like a little, building with like a smokestack. Mm-hmm. That's going to be a date in the past. That's a manufacturer date. They write that on there too. So you're going to have 2 dates. Make sure you're looking at the right one. Obviously, the manufacturer date is going to be behind you. But make sure you check the expiration date. And that's the one right by the little, kind of game timer type.
Okay.
The other thing to kind of keep an eye on here, there is a storage temperature in here. So this says store between 35.6 and 86 degrees Fahrenheit, right? Mm-hmm. So you've got kind of a wide range, but don't leave this in your car overnight. It's super hot out. That will degrade everything that's in this box. So if you buy it, bring it into your house. Don't leave it somewhere where it's going to be past. That temperature is really important. In the laboratory, we actually monitor that temperature. We write that down. We document that every day. So your storage temperature is really important.
Okay, so we want to make sure these are the most effective as possible for your $13 a piece.
Yes.
Okay.
So we've already done a lot of reading. I haven't even opened the box yet.
Know.
So when I tell you to read the directions, it's
you
really
aren't messing
important.
around. Okay.
So I think all of the boxes come with 2 tests. I did open this already so that I didn't have to fumble with like stickers.
And you brought one for me.
I did. I brought
so
two.
nice.
So we have two.
Okay.
So let's see what's in here. All right. So what do we have? So we have directions. We have directions in Spanish, and then we have this fact sheet. So we'll start with a fact sheet. This fact sheet is available for every test that has EUA. So we actually have these in the laboratory as well. We publish a link to this with all of our laboratory tests. So this gives you kind of a rundown of what the test is about, what it detects, all of that information. So maybe while you're waiting for this thing to incubate, you can read this fact sheet. Here's the directions. What do we have in here? So we have 2 cards. I'm going to give you a card.
Okay, I got one.
And then we have a nasal swab. And we have these little droppers.
Okay.
So I'm going to push this whole thing over to
Okay,
you.
so I get a swab and
Yep. So a swab and a dropper. So that dropper has the liquid in it. We have this swab. I hope that we can open these easily. This is going to be, we might need some scissors.
Or my teeth.
Might
Don't
have
use your
an
teeth.
emergency break.
Okay. Are we getting scissors? I see our scissor tech is on his way out.
This was the last thing. Oh, wait a minute. There's a bottom. Wait, we figured it out.
Okay.
Yep. How many degrees does it take to open the package?
Right. Well, I'm not going to get it.
Try the flip side on the bottom, or else I can just.
Oh, there it is. Okay,
There we go.
figured. How many people does it take to open a plastic?
I probably should have practiced this.
I know,
beforehand.
right? Okay. So,
Okay.
So do we have to like wash
The
our
other thing we're gonna do is hand
hands?
hygiene.
Okay,
Yep.
we got our.
Do some hand hygiene to clean hands.
Thank you, Jill. I got it. We found it.
Yeah.
But I might need scissors for something else. Who knows?
Yeah, there you go.
You never know.
All right,
Thank
so
you.
we're going to do our hand hygiene.
Okay.
We're going to get our directions out.
Okay.
I'm not going to do this right now because we're going to try to keep this at a reasonable clip, but ideally read the directions before you start this
Okay.
process. Okay, so we have this little card. So this is what these cards look like.
take them out. Okay.
Yep, and they do open. We're going to open that in a second. And you want to lay the card flat. So you want the card to kind of be laying flat.
Okay.
And you want to go ahead and open it like a little book. If you
Okay.
need to kind of bend it kind of backwards,
Kind of like that.
that's
Okay. There it's flat.
Okay, and then you see there's these 2 holes, so there's 2 little holes. So you have this kind of wicking strip over on one side,
Let's see my.
and then you've got 2 holes over here.
Okay.
Yep, so here's our 2 holes. We're gonna put our liquid in here, and here's our wicking strip. This is where the test is actually gonna be performed.
Okay.
Okay.
Gotcha.
All right, so let's get our liquid ready.
Okay.
That just twists off.
Okay.
Yep. And we're gonna do 6 drops in the top hole.
Okay, so there's a smaller one. There's a
Yep.
small one on top and a bigger one.
Okay.
So
And a couple things about doing drops. So we want to measure this as accurately as possible. So you want this completely vertical. So don't do it on the side and drop
Okay,
like
you're
this,
gonna do
straight
it.
up and down.
Got
Yep.
it. Okay, so
And don't-
6 ends there.
6, and don't touch the hole.
1, 2, 3, 4, 5, 6.
All right,
I think.
6 drops.
Okay.
Put this on the side. Okay. So then we're gonna swab our nose.
Oh.
So
fun.
a couple things. So we got this handy dandy swab. This is really similar to what we use in the laboratory. I think I own some of these in the lab.
Okay.
Open it not at the part you're gonna put in the nose. So open
Got
at
it,
the top
okay.
part. You got that. All right.
Oh gosh.
So
I know
a
the
couple
guys are
things.
loving this.
So
Yes,
we just
big thumbs up and cheers from the guys in the back.
we're
Okay.
just gonna go about an inch in, right? So you don't. This isn't like all the way in the back. So you're
Oh,
just kind of
okay.
doing in your nose, and the goal is so the virus really is living in the cells that are around like the side of your nose. Okay.
So none of this back in the throat thing.
So you
that they
don't have
used
to go
do?
all the way back there, but what you also don't want to do is you don't want to just collect snot, right? So if you're like
Okay.
really sick and you're really mucusy, don't just kind of swirl it around and get snot. You really want to get to the edge. So you can do one of 2 things. You can either swirl it on the side and really rub. I like to put it on the edge and press in and then kind of swirl like this.
Okay.
So
Oh,
into
I'm
the
gonna see you.
nose.
Okay,
into the nose
That's not
right
very
there.
far.
Nope.
Okay.
And then press and kind of swirl around. It
Okay,
should
swirl
hurt
it
like a
up.
little.
Like on the inside of the nose?
Yep, on the inside of the
You guys
nose.
See, it's like. It's like, does that look right?
Looks great.
This is easy.
Yeah.
So much better. That's it?
So if it
I can
didn't-
take it out?
You can take it out.
Okay.
Yeah. And then you want to do the other side.
Oh.
So you got to do both sides.
Okay, no.
So we're going to do both sides.
Wait, what should I just do? I got to do this side now. Okay.
All right.
So you're just like scraping almost the inside of the nose.
Yeah, so you
Not-
want to make sure. Ooh.
You're getting like
Yeah, you got to get all those cells that are kind of around that, right?
But
So
don't go
that's
far
where
back.
that's where the virus is living, but you can be just kind of in that like initial
Okay.
nose. Yep.
Okay.
So don't, if you can't get there with your finger, that's you're too far. Just finger length in there. So.
Okay, try not to do
All
that
right.
often. I try not to stick my finger in my nose.
Remember when you're a kid.
Okay.
Okay, so now we have our collection, so we're good. We kind of
Okay,
get a little
okay,
sniffly.
yeah,
Hurts
yep,
a little bit,
yep.
but not too bad. So then you want to put your swab into your kit. So it goes in the big hole and then kind of out on that little one. So here you can see that picture. This is where the picture helps a little bit. See how that's in?
Okay, I'm going to watch you. Okay, so you're going up and under?
So, yep, up and under. Okay. So
Through
it's
the big hole.
Yep, and then you'll just see it poke out a little bit on that top.
Yeah.
And then you want to swirl it 3 times. One, two,
two, three.
So what we're doing here is we're coating it in that liquid.
Got it.
Right? So that liquid is your extraction,
Can you guys
and so
see
that's
it?
getting everything out.
Can you guys see this? I don't know if you can get a closer shot, but anyway, so you're
All
going to
right, so we swirled it around 3
Swirled it,
times. That's
okay.
really important. We did both of our nose nears,
Got
both
it.
sides, swirled around 3
Swirled.
times. Okay, now we're going to close the book.
Okay, you close the book.
So take off the little adhesive piece. That's going to tape the book together.
Okay,
on the
here.
right side. Yeah.
There.
Okay, and then close the book.
And don't do anything with this thing.
Nope.
And
And
close-
press that down.
Oh, that's it.
Yeah.
Okay.
So what has happened there is that strip that you saw, so there was a strip, it's a wicking strip on the
Okay.
outside. That now is in contact with your swab and that
Can I turn it
liquid.
upside down so people can see what it looks like? No,
For these purposes, yes.
Yes, okay, I'm turning it because you can see like the thin blue line. Like,
Yes. So
Like-
that blue line is your control line. It says control there.
Okay.
It's going to turn pink eventually.
So it's like a pregnancy test.
It is. And then under that, you're going to see samples. So I can see in mine, I can see it wicking up. Can you see that?
Yeah,
Like
okay,
liquid?
so but normally to tell folks at home, we're going to keep this flat.
Yes, so
Okay.
keep it flat. Yep. So you're going to wait. That liquid is going to move up that strip.
Got
And
it.
So what
Okay.
it's doing on that strip, there's some antibodies that are printed. So you have antibodies against the COVID N protein. It's printed on there. And
Okay.
so we're going to wick that up. If you have those proteins there, they're going to attach to those antibodies. Those antibodies are going to grab them.
Okay.
And then it's going to go up to the control, and the control makes sure you did it right.
Okay.
So if your control is negative, it didn't work, so you
Okay.
want to stop. And then what you're going to read here in 15 minutes is you're going to read that sample line.
Got
so
it.
if you have a line there, oops, we probably will want to mask up very
Got it.
quickly.
Okay.
That's going to mean that you're positive, and if you don't have a line there, that's going to be interpreted as
Okay.
negative. So I forgot a lab timer, so I'm going to do my phone timer.
Okay, and I'm going to grab some community questions because I know we've got
Yes.
some
So we're
coming
going to do
in.
15 minutes on the timer. So
Okay.
you want to read after 15 minutes, before 30 minutes. So that's your window.
Got it. Okay.
So while we're cooking these, yeah, we could talk about some other stuff.
Let's do. Okay, so we'll just
let's
set
do
these-
hand hygiene after
Okay,
we.
I like that.
Yeah.
All right.
Clean hands. All right.
Okay.
So,
Oh, I had a question though about can you test? Does COVID come through in a blood test?
the virus itself, no, but
Okay.
we can look for the immune reaction to the virus. So these are our antibody tests. And so if we're doing a blood test, we're looking for antibodies, our immune system's reaction to the virus.
Okay.
Or if you're vaccinated, you can also look for your immune system's reaction to the vaccine, so the production of those antibodies.
Okay. And hey guys, I wanted to let people know about the Go Get Tested information, if we can put that up on the screen really quick before we get to some of those. So if you need a COVID test, visit gogettested.com to find a location near you, because we do not want you to visit the ER. We want people to come to the ER if they're sick and need emergency care. We want to take care of you, but because hospital beds are in short supply right now, our staff, as you have heard us talk about, is stretched very, very thin. You may have a long, long wait to get a COVID test, so you don't want to do that. You want to find one of these locations, and that information is listed right there on your screen. So go do that. Try to avoid the ER for testing. Come if you need emergency care. Okay, so I do have some questions coming in, so I thank you to everybody for just being patient. So Stephanie says, can the at-home be positive, but the PCR and rapid were negative? My husband's whole work crew was positive, and after the home tested, it was the other. We are all vaccinated. So she was just wondering, is that possible?
So home test was positive, PCR was negative?
It's
Did I hear that
home
right?
can the home test be positive, but the PCR and rapids were negative?
Yeah, I would, if I had this case, if I got called about this, I would have some follow-up questions. And the primary one is going to be, what's the time frame between the home test and the PCR? So there's a couple potential options. The first is that your home test was a false positive. We aren't seeing a lot of those. The specificity of this test, so the number of false positives is really good. We don't see a lot of false positives. So I think that's probably the least likely outcome here.
Okay.
Another option is if you took the home test and then it was a day or two later and you took the PCR, especially if you're vaccinated, you might have actually cleared that virus really quickly. So I think what we're learning about Delta breakthroughs in vaccination is that they have very high spikes in virus, and then that actually decreases very quickly. So I think your immune system is kicking in, you're clearing that out really quickly. And so that would be something that I would want to consider, that possibly what's happened is that you've cleared it quickly if there's that time frame in between there. If this was something that we did in our lab, we would probably want to do some retesting, make sure that we didn't have any issues with the actual test. So we would work that up. But those are my two initial thoughts, and that time frame I think is probably would be my most likely scenario that I would consider.
Doc Hock, what can you add to that?
And I think it's going important to one of the first things you said, which we're always concerned about if we are looking at the influenza test and the antigen test just like this. When there's low amounts of infection in the community, more than likely that test is going to be a false positive. But I think with such high amounts, high prevalence of infection around the community, you have to treat this antigen positive, this home test positive, as a true positive.
So Isaac and Sandy have similar questions. Isaac asks, what are your thoughts on people getting antibody tests post-vaccine to prove that the vaccine is effective and has worked?
Yeah, I mean, it's not something we recommend at this time, largely because we don't have a lot of data to understand what that means. So I don't know, especially if you're immunocompetent, I haven't really seen anybody that was vaccinated and had no reaction by, an antibody test. But some people want to understand, well, do I have enough antibodies? And that's a question that our tests at this time just can't answer. I think if you have, if you're not immunocompromised for any reason, I think that there isn't a lot we can offer from a testing perspective outside of, statistically the vast majority of people, if not all people, have a really good antibody reaction to that vaccine. Dr. Hawkinson, I don't know if you have anything to kind of add to that.
Yeah, I mean, my guidance, and I think the official guidance, just like you said, is not to be checking antibodies for this. We don't know exactly what is that level of antibody that causes you to have protection. We are starting to learn more about that. But the immune reaction, the immune system is much more than just the antibody test. So if you're otherwise not immunocompromised, such as uncontrolled HIV, blood cancer, chemotherapy, solid organ transplant, if you don't have any of those other immunocompromising situations, we wouldn't advise getting an antibody test to look for immunity.
Lori asks, how accurate are the Abbott rapid tests from a clinic? Now, these are Abbott. Is that would be the same?
The rapid tests from the clinic are the same thing. Yep, they're essentially the exact same test, packaged probably a little bit differently, price point a little bit differently, but it's the exact same test.
Okay, good to know. Sharon asks, Dr. Hawkinson, we're back to people being concerned about going to get their teeth cleaned.
Yeah.
She said she's vaccinated but still concerned about going to the dentist with 3 patients in one room with only a short 4-foot wall between them, saliva being, splashed around. You know what it's like going to the dentist. So she just wants to know what your thoughts are.
Yeah, since the beginning of the pandemic, those groups of care providers that worked so closely with patients, and I mean closely in proximity, such as eye doctors, dentists, ENT physicians, they have developed really good safety protocols and systems. So I think going to any of those places is going to be quite safe for you. Wear your mask until you get the examination or the procedure, and then after you can put it back on. But usually those places have tended to be very, very safe, and we haven't seen a lot of reports or any at all about clusters or super spreader events in those areas.
Yeah, I've been to the dentist several times during COVID, and I always felt really safe. Have you had a chance to get to the dentist?
Yep.
Yeah?
Not yet. I'm definitely due, but I would recommend the same and feel pretty safe.
Yeah, they've been doing it pretty well. Okay, so Michael says, I share everyone's optimism about masks helping in schools, but he fears that we're basing our optimism on the Alpha variant. Do we have data that masks in schools will prevent spread of the Delta variant, or is it the same? What do you think?
Yeah, It's essentially the same. There's no real difference from that standpoint as far as the non-pharmaceutical interventions go, and that is masking, distancing, good ventilation, hand hygiene. So there really is no different properties as far as the virus goes that would not allow those things to continue to protect you if you are doing those things.
Carol asks, she's just curious, do vaccinated people who get COVID have antibodies?
I would say yes.
Yeah.
I mean, I don't know the full extent of that question. So if you're vaccinated, again, if you are not in that immunosuppressed population, more than likely you are going to have antibody. You are going to have B cell responses, T cell responses. But getting COVID or getting infected is not it's not unusual. And I think we've kind of changed this word, unfortunately. We're calling it breakthrough infection. You know, these vaccines were never made to stop infection. They were made to stop and prevent and decrease your risk of that whole spectrum of disease, whether it's feeling ill for 2 or 3 days, or whether it's the more severe disease of having to go to the hospital, going to the ICU, and of course dying. So that is what these vaccines do very well. So I would expect, most everybody who's gotten vaccinated, and if they don't fall in those immune compromised populations, they are going to have antibodies, but also those other T cell responses as well.
Sue wants to know if someone in the home has cold symptoms and is awaiting COVID results, should an immunocompromised person scheduled for a booster today go ahead and get that? That person doesn't have any symptoms. So they share a home.
So exposure, I don't know.
Possible exposure. Someone in the home has cold symptoms, is waiting for results.
Mm-hmm.
But
So potential exposure.
Yeah, potential exposure for an immunocompromised person who was going to get a booster today. Should they go ahead and get that? Any reason why they wouldn't?
Yeah, I don't think there's any guidance for if you are a contact of somebody who may have it. I would still go ahead and keep it scheduled and go get that, as long as you're not symptomatic. And of course, if you do become symptomatic, go get tested.
Okay, Angie says, I have had 3 COVID nasal swab PCR tests, all negative. The first 2 in November and then in January said negative for COVID, flu, and RSV. The one done last week just said negative for COVID. Why the change?
That's a good question. So I think that when we expect to be in respiratory season, so this upcoming respiratory season, if you have symptoms, we want to test you for the common viruses that might be causing those symptoms. Mm-hmm. And here in August, right now, we expect that really to just be COVID, maybe RSV as well, depending on sort of your age and population. But when we move, into influenza virus season this year, and then what we expected last year, although we didn't see any flu last year, that differential broadens, right? So now we are concerned that you might have influenza virus, you might have COVID, you might have RSV. Those things clinically all look very, very similar. And so from the laboratory perspective, we want to test you for all of those so we make sure that we make an accurate diagnosis. I think we're going to start seeing that as we move closer to influenza season, starting probably October, November, December, as we prepare for our respiratory viral season. We're going to start testing symptomatic patients, not only for COVID, but also for influenza A, influenza B, and RSV, because they all just look very similar. So I imagine that was what happened. The laboratory that was testing is looking for different viruses depending on what season we're in.
Okay, so here's a good question. Let me just find it again. Melissa says that she had friends that went to get a PCR test. They spit on a cup, in a cup, instead of getting the nasal swab. They were told this is more accurate. Is that true?
I would disagree that a saliva test is accurate. The saliva tests are good. They're good tests. We know that they are pretty decently sensitive. They compare reasonably well after some optimization over the summertime for some labs. They compare reasonably well to getting the nasal swab. I wouldn't say the data supports that they are more accurate or more sensitive, but they're good tests. I think that it's definitely an option, especially for patients that really don't like having the swab in their nose. If they can find a saliva testing site, that might be a great option
and
for
that
them.
might be, especially if it's deterring people from getting it.
Yeah,
so, and that's
yeah, for
Anil.
sure. Yep.
Good morning, Anil, by the way, because he's asking, are they still brain ticklers, or are we using the shorter swabs for testing than we were last year? So these obviously are shorter and much more pleasant, but are they still out there where they're jamming them up there?
Yeah, I mean, that's how we still do it. The nasal pharyngeal, so the brain tickler all the way back in the back, is still the most accurate, and so we still generally use that option. It depends a little bit on where you go. Some people will do just the nasal. Some people will do mid-turbinate, so sort of in between all of those. Some people will do saliva. So, if you're really concerned about it, you can inquire at your testing site and find something that is a good fit for you. The nice thing about where we are at this point in time in the testing environment is we have a lot more options, and so individuals really shouldn't be afraid of going and getting tested or think that it's going to be really painful. We have some options available for them. So.
Couple more questions, because I know your timer is about ready to go off on our test.
Yeah, I think,
hope. How many more?
2 minutes.
2 minutes. All right, let's try to squeeze a couple more in. Melissa wants to know, if your kid is in a mask optional school, would you test your kid weekly? My kid is one of few wearing one.
Yeah, it's an option. I think certainly some schools are doing that. I think it's an expensive option. Dana, what do you think about that?
I agree. I mean, I think, we have stated that I think we are having to move into this individual phase where you have to do the most you can to protect your family and your bubble group if you can. That is certainly with vaccination. That is another option, to test frequently, once a week, twice a week. I can't say whether that's a good or bad idea. Just like you said, it is probably expensive. It's probably not needed if you don't otherwise know of any contacts of infection, or if the child or yourself is not showing symptoms. I don't know that it's needed, but these are the options out there, and it's insightful for me to hear these from people who are really thinking about the safest way and the best way to do things. So it is an option. I don't know that it's needed unless, again, of any specific contacts that are infected, or say a child's extracurricular team or classmates, or if anybody in the household is having symptoms. I don't know that you just need to do that screening test once a week. I'm not sure how the utility for that would be, but that is always an option out there for people to do.
All right, I've got 3 questions, but they're quickies, so I want to try to get these in. So Arietta says, do pharmacies have PCR tests or just the rapid tests?
So what you're going to buy off the shelf is just going to be the rapid test. Okay. So if you go in, you buy a box off the shelf, that's going to be a rapid test. But the retail pharmacies will offer a PCR. Usually you're going to go through a type of drive-through swab clinic of some sort. They're going to send that off, so they're not running that on site. So if you get a really quick result, they've given you a rapid test that's not a PCR in most cases. If you get a result that takes 24, 36, 48 hours, that's probably a PCR. And that information should be told to you in your results. So we're required to make it very clear to the patients, to the people getting tested, exactly what we're testing. And so if you get a rapid test, it's going to say the word antigen in there. If you get a PCR-based test, it's going to say something like PCR or NAT or genes or something kind of like that will give you an indication that it's a PCR.
So look for it or ask about it.
And definitely ask about it. Yeah, if you have any questions, the people that do the testing should know and should be able to communicate to you exactly what they're testing.
Dr. Hawkinson, Jackie wants to know, can she get her booster and her flu at the same time?
Yeah, the original guidance when the COVID vaccines came out was you wanted to separate any vaccine from any COVID vaccine by 2 weeks. Now, this was just due to lack of data, understanding, and experience. But since that time, and especially when the adolescents had it authorized to get the vaccine for those younger age groups, we made sure we didn't want to miss those pediatric patients that could come in when they need 2 or 3 different vaccines at the same time. So right now the guidance is that you may get additional vaccines at the same visit as you're getting your COVID vaccine, and certainly getting influenza and COVID vaccine at the same time is going to be okay to do.
And just last question, Kathy says she needs her booster, but she's having trouble getting it at her hospital. Does KU have booster shots easily available? How does she go about getting in for one?
We do, and we can probably put up the graphic of the number to call for vaccines, but we do have plenty of vaccine and slots available to go ahead and get vaccinated.
Okay, while we have that up, that's for our COVID testing. Thank you for that, and thank you everyone for your questions. This is where you go and call if you need to go get tested, because we don't want people going to the ER because staff is very busy, and we want to make sure that people who are going to the ER can be taken care of properly, and we don't want you to have to wait long to get your COVID test. So you can call one of these numbers right there on your screen if you need COVID testing. Okay, so it is time. Speaking of COVID testing, we did these earlier about 15 minutes ago.
Yeah, so 15 minutes. So read between 15 and 30 minutes. So
Okay.
we're right in that sweet spot. All right. So the first thing you want to do is check your control line.
Okay.
So your control line should be pink.
Got it?
So that's this top line. They've written control. Some of the older tests had C. People got confused, thought that meant coronavirus, but that means
Oh.
control. It's always going to be the last line. So if it's pink, that means you're good. The
Okay.
test worked. So did your control line work?
It did.
All right, success. And then you want to read your sample line where it said sample. So there's going to be a window in there.
And I got nothing.
Good. Yep. So if you want to read that, you're looking even for a faint line.
Okay.
I would consider that positive. So
Okay, that's a good question.
I've talked to a couple friends who have read this, and then they kind of look at it and they think, "Oh, is it there?" And
Am I
sometimes-
seeing things? Right.
Sometimes they do a second one. So even a faint line you want to consider positive. It should be pink. So any other colors, don't think about that. When you do this, make sure you haven't done like a nasal spray. Don't put anything in your nose for at least 30 minutes.
Should you blow
prior
your
to
nose
doing
first?
it.
Because when I've gone to get them, like here at the health system,
You can.
I'll blow my nose.
Yep.
They'll have me blow my nose.
Because again, remember, you don't want to just sop up the snot in your nose, right? You really want those cells that are on the outside of your nose, and so kind of clearing out your nasal passage is
Okay.
going to help a little bit.
All right, so remind everyone, again, you got this at CVS,
So
right?
I got it at CVS. Cost me what, $26
For 2 tests.
For 2 tests, yep. And I think you can get them. You can get them at Walgreens. You can get them, I believe, at Target. I think you can get them at a lot of your standard, probably Walmart, your standard retails. They have 2 of them. Again, I'm not promoting the Abbott Binax, and they also have the Illume. That's an equally good choice. No real differences between the 2 of those. So.
Thanks for walking us through this though, today.
Yeah.
And
They're
like,
a little more complicated than you think, so just read those directions.
don't rip open the box like I would
Yep.
do and start tearing everything apart. That's what I would do. Do what Dr. Liesman does.
Yeah, put on your laboratorian hat.
Yes.
Really kind of, specific, follow everything
Yes.
to the T.
Yes.
And then you'll have a successful test.
Play laboratory professional. Absolutely. Thank you so much for bringing these in.
Yeah,
That was
absolutely.
great. I want to get to our final thoughts today, and I'm going to let you get us started. What do you want everyone to know?
Oh gosh, please get vaccinated. I think that that's going to be the best way out of this situation. I was really happy when the vaccine was offered to me. Now, 7-8 months ago. I hope everybody will take the vaccine, especially now that Pfizer has FDA clearance. And then if you're symptomatic, test. We have a lot of options. We have a lot of surge capability. We're getting tests out a lot faster. It's a very different situation than we were in a year ago. And those of us in the lab has worked really hard to get us to that situation. So please go get tested if you're symptomatic. Get vaccinated. Be careful. Be safe. Wear your mask. So.
Thanks for all the work you and your
Yeah.
staff are doing. We
Yeah.
certainly appreciate
Thanks
it.
for having me.
Keeping
This was
this
fun.
going. Yeah, for sure. You will be back, Dr. Hawkinson. So will you. What are your final thoughts?
Yeah, and I would say we probably believe that the accuracy of these at-home tests is probably better if you are symptomatic.
Yeah, agree.
Just because at that point you are probably having the highest amount of replication going on where the swabs can pick up those viral particles. So, I would agree with our guests. Continue to get vaccinated. We haven't seen a large uptick here after the approval, but again, it's been less than 24 hours. So we do hope and expect to see more people coming in to get the vaccine. If you want to schedule here, again, we have plenty of doses and time slots available. The phone number is 913-588-1227, so same as the call center for COVID, the test and the vaccine there. Please call and encourage people to get vaccinated so we don't have to see any more news stories about people who really didn't understand what COVID was until, after they've been on the ventilator for 20 or 30 days and are now only starting to recover. or those people who wish they would have gotten the vaccine early. It is very real. You can protect yourself from those types of things, so please go get vaccinated.
Great message from both of you. Thank you so much, and thank you all for being with us today. We always appreciate you joining us. Tomorrow, he is back. It's another episode of Open Mics with Dr. Stites. Emergency departments, we have been talking about this. They are struggling, faced with too many patients and simply not enough room. Dr. Stites is joined by our Chief of Emergency Medicine, as well as the Medical Director of Johnson County EMS, to explain how hospitals are handling this high volume and what effect that could have on you. We will see you tomorrow. Have a great day.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.